Namaskar, we have with us Dr. Prakash Boominathan, a very well-known face in the area of voice. So I'm having the privilege to get the larynx explained by him. So Dr. Prakash, can you just explain me this particular model in brief so that
Thank you.
some of our students understand? Yeah.
Okay, so this is the model of the larynx.
Right.
Okay. So what you see on the top is the hyoid bone.
Okay.
And then you have the thyroid cartilage, the
Right.
cricoid cartilage, and the trachea.
Right.
bit. So the larynx is sitting at the entry of the trachea, and the hyoid bone is the only bone around the neck which suspends the entire laryngeal framework. Right? And so the thyroid cartilage is the biggest part of the entire laryngeal framework, and the space between the thyroid and the hyoid is the thyrohyoid space, and the thyrohyoid membrane. This is the cricothyroid space between the thyroid and the cricoid, and that will be called and it is covered by the cricothyroid membrane.
Is there some significance of this thyroid
Yes.
space
So
in the cricoid?
the entire function of larynx, when you look at it, the space. I mean, as much as possible, if you are able to pull the larynx down, the larynx will be in the relaxed state. The vocal cords will be in the relaxed state.
Okay.
So when the thyrohyoid space and the cricothyroid space is larger,
Yes.
then automatically the voice quality is much better. So that is one of the ways to. And when you do therapy, many times circumlaryngeal massage, or when you are doing certain sort of laryngeal manipulation, these are the spaces you have to work so that you can expand.
So-
you can put a little finger in that much space. You can, that normal anatomy will have so much space. So that much when the larynx is not tensed, when the perilaryngeal muscles are not tight and the laryngeal space is kept normal, you can put a little finger in. That much space should be maintained.
Should be maintained.
Should be maintained.
Okay, and in the digital manipulation, what do you do something with these spaces?
No, digital manipulation is usually around the when you start, you hold it, the thyroid notch. That is a place where you hold, and you pull it down, so you increase the space here.
So these spaces
And when you want to increase the cricothyroid, you can't pull the cricoid further down because you have a trachea attached to it. So, and you can't pull this up also, but you need to create this space, means you need to position this thyroid in a place where there is a little space there. So you will.
So it goes appropriately back
Yes. So you will manipulate it this way.
No.
So you will massage it this way, and so the space will get released. That's how you do it. The inside of the larynx, you have from the top you have the epiglottis, which is there, and it's a three-level valve. So you have the epiglottis, and then you have the false vocal cords and the true vocal cords. So you have the epiglottis is the half here, yes, and then you have the upper part, which is your false vocal cord.
Okay.
Then you have the true vocal cords.
True.
So there are three-level, three-tier
1, 2,
valve.
3.
Yeah.
Okay.
Which is what is required for maintaining this balance while a person is swallowing and when a person is speaking. So when you swallow, it's a three-tier valve. So the true vocal cord closes, then the false vocal cord closes, and then the epiglottis closes, and it opens up the space for the esophagus, and then the food goes into the esophagus.
Okay.
And there will be a laryngeal descent and then an ascent. So that will,
While you swallow, it goes down and then it goes up.
So that is how it happens. The true vocal cords is the most important part of the vocal thing, and that's made of 5 intrinsic muscles which you can't see in this model.
Okay.
So it basically does, say I would think, 2 groups of action. So it is closing, opening, stretching, contraction. So these are the 2 group of actions which the vocal cord can do. So one group of muscle which is responsible for opening, only one muscle, that is posterior cricoarytenoid, PCA. And for closing, you use the opposite muscle, lateral cricoarytenoid. Stretching, you use cricothyroid. Contraction, you use thyroarytenoid. Okay, so these 4 are the intrinsic muscle. Complete closure of the vocal cord happens with the help of lateral cricoarytenoid and interarytenoid. Between the 2 arytenoids, you pull it further, the complete vocal cord closes. So opening, closing will produce sound, will interrupt the airstream and will start producing sound. The pitch of the sound is determined by the lengthening of the cord. When the cricothyroid stretches, you produce high pitch. The thyroarytenoid contracts, you start producing low pitch.
Right.
That finishes.
Fantastic. That finishes this topic. Thank you. Thanks a lot. Many of us would be learning many things from this. Thank you.
Thank you.